And we have gotten to the point where we left off talking about the EKG. One of the things that I did in your Canvas site is if you scroll all the way to the bottom under the modules, you'll see that I created a module for videos. And these were those videos that we were looking at based from the book's website. So hopefully, let's just make sure one of them is going to play. So let's look at this conducting system, since that was the last one that, or the last topic, I should say, that we were focused on. Let's see if it's going to play.
To the atrioventricular node. Action potentials pass slowly through the atrioventricular node to give the atria time to contract. Potentials originate in the sinoatrial node and travel across the wall of the atrium from the sinoatrial node to the atrioventricular
Yes.
node. Action potentials
You got to
pass
laugh,
slowly
take it
through
outside the classroom.
atrioventricular node
Don't play it
to give
here.
the atria time to contract. They then pass rapidly along the atrioventricular bundle, which extends from the atrioventricular node through the fibrous skeleton into the interventricular septum. The atrioventricular bundle divides into right and left bundle branches, and action potentials descend rapidly to the apex of each ventricle along the bundle branches. Action potentials are carried by the Purkinje fibers from the bundle branches to the ventricular walls. The rapid conduction from the atrioventricular bundle to the ends of the Purkinje fibers allows the ventricular muscle cells to contract in unison, providing a strong contraction.
That's pretty much the point that we had left off. And those were the peaks and the valleys that happen in an EKG. And when we left off, we were looking at some of the different issues that can happen in an EKG. And if you remember, we looked at what would be normal, and therefore anything that deviates from this is going to be abnormal. And our hope, of course, is that the doctor is going to be able to look at that and know what part of the heart is having an issue and be able to address it. So in the next part of the chapter, in looking at the heart, we're going to look at our blood flow, which we've technically looked at. Okay, we've looked at the flow through the heart, but now we've got to pay attention to, once again, what is going to be affecting that flow. We've mentioned that, of course, we're going to have pressures that are inside the heart chambers themselves, okay? So we're going to have some different factors that are going to actually govern the flow of blood through the heart. As the blood moves through these vessels that we have and in these chambers and these valves that are present, one of the things that's going to happen, they're going to create heart sounds. And when people listen to the heart, you'll be trained on what is the normal sound, and therefore when you don't hear that, you'll know something's abnormal. And we're going to revisit that cardiac cycle. If you remember, the cardiac cycle is one complete relaxation and contraction that's taking place in the heart. So all four chambers do that. But if you remember, for this contraction and relaxation that's taking place, with this contraction and relaxation, the majority of the heart muscle is around those ventricles. We're going to be very dependent on blood flow from basically just against gravity, well, with gravity, I should say, with gravity as we go from the atria to the ventricles. We're very dependent on gravity. But once we're into the ventricles, we're going to have to see that we're dependent on the contraction of that heart muscle itself. So we're going to say that we have principles of pressure and flow. And this is going to be governing the flow of the blood through the heart. So when we talk about flow, the movement of that blood, it's governed by our pressure, and then what we're going to term resistance, and in this case, meaning what is anything that's opposing the flow of the blood. Now, all right. Opposing the flow of the blood. There can be several things. All right. So when we're looking at this, we're going to find that the thickness of the blood, anything dealing with the vessels, any disorders that might be present. There are many things that can actually affect this. And these outside forces as well as inside forces are going to play a part in what happens to the flow of blood, which means we're going to have something that's going to be playing a part in how the blood makes it to the tissues of the body. For pressure, pressure is a force. Now, in thinking about our cardiovascular system, we tend to associate pressure with being high or low. That's how we tend to think of it. Well, yes, okay, but there are other factors, like I keep saying, internal as well as external, that can affect these factors. Now, fluids flow if a pressure is greater at one point than another. What does that mean? Okay, you guys know how I keep talking about these capillary beds and that web of everything that gets created? And on one end, I have an arterial end. On one end, I've got the venous end. And at this point, these capillary beds, they are found in the tissues that, of course, contain the cells. And those cells have extracellular fluid, okay? So as blood flows in by way of arteries, and then we have the veins, and there's a point where an artery meets a vein. Now, one of the things that will affect the movement of fluids in these vessels right here at this stage is what is the pressure at that tissue level. So, if pressure is greater here in the tissues, well, what do you think will happen to blood flow in the vessels? Fluids flow if pressure is greater at one point than another. If I have greater pressure in the tissue side, what is it going to allow for materials in the blood to do? Flow. So that's a good example of fluids flowing if pressures are greater. Now, in our heart, we know that we have this right side, left side. The right side goes to my pulmonary circuit. The left goes to my systemic circuit. I keep trying to stress that the way that the muscle is found, that the majority of my cardiac muscle, which is passing that electrical impulse to make those muscles contract, that the majority of it is found in my ventricles. But atria still contract. All right? Now, as blood is returning to the heart, okay, I've got some valves in between my atria, my ventricle. The valve is my tricuspid, or my right atrioventricular valve. Now, when blood is returning to this right atria from the systemic circuit, okay, it's also coming into my left atria from the pulmonary circuit. Over here, I got another valve, my bicuspid, the left AV. So as the blood returns to the heart, and we're getting the blood flow, when the atria are empty, pressure is low. As the blood fills the atria, pressures rise. Now, as that pressure goes up, what do you think is going to begin to happen to this valve? It's got to open. So, fluids flow if pressure is greater at one point than another. As this atria is filling and the ventricle is empty, which one has the higher pressure? My atrium. And that's going to help this valve open. Blood will flow in, and this begins to make the pressure rise in my ventricle. Is everybody following me? So, as the blood fills up, pressure rises. Remember, do the atria and the ventricle contract at the same time? No. Okay? When the atria contract, ventricles are relaxed. When the ventricles contract, atria are relaxed. Okay? So, when the atria contract and the blood has been moving, because that valve will open, and the blood has been moving into the ventricle, making this pressure go up. Well, as it empties from here, my pressure goes down, and then the atria will contract and push the rest of the blood to my ventricle, where the pressure is now high, and I've got all these little electrical signals going on, and then they're going to contract and push the blood out. So the fluids flow if pressure is greater at one point than another. So as the atria fills, pressure goes up, begins to fill the ventricle that was low pressure, that's now filling up, creating high pressure. The differences between the two. The differences between one point to the other point we term a pressure gradient. You've all heard of that